Dr. Dana Mincer here. I wanted to do a little segment on the qualifying conditions for the medical marijuana program in Pennsylvania, and also what forms of medical marijuana are going to be permitted in Pennsylvania. So again, I'm looking at my little cheat sheet over here so I don't make any mistakes as I'm talking to you. So the qualifying conditions for medical marijuana include the following. There's 17 of them: ALS, autism, cancer, Crohn's disease, irritable bowel disease, which is also known as IBD, damage to the nervous tissue of the spinal cord, epilepsy or intractable seizures, glaucoma, HIV, AIDS, Huntington's disease, MS, which is multiple sclerosis, neuropathies, Parkinson's disease, post-traumatic stress disorder, and sickle cell anemia. And then the last two are relatively vague. So one is severe chronic intractable pain of neuropathic origin, which just means that you have pain and the pain is due to your nerves. And the other one is severe chronic or intractable pain in which conventional therapeutic intervention with opiate therapy is contraindicated. Now, I have a feeling that in most people that would be the case. Opiates are highly addictive. They have receptors, numerous receptors in the brainstem, and the brainstem is the area of your brain and the bottom area that controls your breathing. So if you saturate those brainstem receptors, you can cause yourself to go into respiratory depression and die, which is one of the things that makes opiates so dangerous. So for those people with chronic pain, I'm really excited because I think medical marijuana is going to be a really wonderful alternative option. And I encourage you to look at our Facebook page, Greenhouse Integrative Medicine, where I posted a little excerpt on the past history of narcotic prescriptions. And I apologized on behalf of the entire medical community because, in my opinion, we failed our patients. Although this came before my time as a practicing physician, narcotics were pushed on patients with chronic pain as standard care for years by physicians, by big pharma, and people got addicted, and they're physically dependent and also mentally addicted to these medications. So please see my post on the Greenhouse Integrative Medicine Facebook page. The second question that I wanted to address in this little excerpt is what forms of medical marijuana are going to be available? So there's a plethora of forms. The dry leaf or the plant form will not be available. So that will be illegal. So you're still not supposed to have the dry leaf or the plant form. And I know that although in Philadelphia County, the possession has been decriminalized, but that's not the case up in other counties, such as Bucks or Montgomery and surrounding counties. So the forms of medical marijuana that will be provided from the dispensaries that are set to open in the spring of 2018 are the pill form and oil form, topical forms including gels, creams, ointments, tinctures, and liquids. It looks like there's also going to be vaporization or nebulization forms available that are they're not from the plant leaf itself. They would be from extracts of the plant that contain the different chemical compounds such as THC and CBD. I really encourage you to think if that's something that you would want to do for yourself. Anything that you inhale damages the epithelial lining of your lungs, and that in turn causes your body to have to reproduce its cells and fix itself. And in my opinion, that sort of sets you up for cancer. It's not really a great thing to be doing to your body if there are alternative forms available. The current studies do not show that smoking marijuana has been linked to lung cancer, but we also don't have that many current studies. The population that has been studied has been very small compared to other drugs that are studied before they even come to the market to be used in humans. And I really think that with further studies, we will find that eventually smoking anything, just like smoking cigarettes, can cause lung cancer. So I encourage you to stay away from smoking anything. So that's it for these questions of the day. If you have any questions for me, you can email me, drdanamincer@gmail.com. That's drdanamincer@gmail.com. Again, check out our Facebook page, Greenhouse Integrative Medicine, and you can also check out our website, www.greenhouseintegrativemedicine.com. And again, if you have any further questions or if you need the registry, just Google PA Department of Health Medical Marijuana, and voila, you will find it. Okay, hope to hear from you soon. Bye.